Imagine you are in a hospital facing a serious medical condition. Of course, you want the best possible information from your doctor to decide on a medication or a treatment that may save your life or the life of a loved one. However, the doctor looks around nervously and hesitates before leaning in close so that they can whisper to you in fear that others may hear what they have to say. This sounds like a dystopian nightmare, but it is a reality facing patients and doctors now. In this video, we will examine why is a doctor qualified to prescribe medications or to conduct medical treatments? How do doctors know what to prescribe or what to do? How is the practice of medicine being controlled? Stick around to the end of this video where we will consider, should what doctors say and prescribe be regulated? In this video, I'm going to focus primarily on a doctor's role and responsibilities in prescribing medications, but the same principles apply to medical interventions and treatments. So the question is basically, why is a doctor qualified to be a doctor? If we take a look at the training that's involved, doctors are going to go through 4 years of undergraduate school. This is the basic college experience that students do after high school. And in that time, they're going to earn a Bachelor of Arts degree or a Bachelor of Sciences degree in the basic sciences. They'll take an exam to get into medical school. Medical school is going to be 4 years. The first 2 years of medical school is going to be involved learning basic medical science, so applied science in the medical field. And then they're going to take a licensure exam. They're basically going to say, do they know this basic medical science? After that, they're going to do 2 years of clinical medicine. And so getting more experience in kind of the hands-on aspect of practicing medicine. At that point, they're going to take a second licensure exam, and they're going to graduate from medical school with either an MD, a medical doctor degree, or a DO, a doctor of osteopathy degree. At that point, these newly graduated doctors are going to spend 1 year as an intern. And as an intern, they're going to be doing a supervised medical practice under the guidance of established physicians. And at the end of that year, they're going to take a third licensure exam. And so basically, they have to take 3 exams to show that they have the knowledge and the skills necessary to practice medicine. Then most disciplines, most specialties within medicine are going to spend 3 to 7 additional years of residency when they are basically almost like an apprentice, working with an established physician to learn the ins and outs of those specific medical treatments, medical procedures, even medical prescriptions, drugs to use for the treatment of specific conditions in that discipline in order to become a full-fledged, fully experienced, fully trained doctor. In addition to the academic and clinical training that a doctor undergoes to become a practicing physician, they're also going to join a professional organization or medical society. Within this organization or society, they're going to establish the professional expectations for that field, and they're going to establish kind of codes of conduct and ethics as to what is the appropriate care, or at least the appropriate approach at providing care as a physician. Some areas of medicine, such as anesthesiology, emergency medicine, or in this case, plastic surgery, may have professional organizations that require additional training and experience to prepare a doctor to be a specialist in that field. These organizations may also define what is the current standard of care and expectations so that certification indicates that the physician is highly trained in that area. As described earlier, physicians take a national medical exam, but they're licensed to practice medicine in individual states by that state's medical board. The medical board reviews a doctor's credentials, including academic transcripts, evidence of advanced training and experiences, professional organization certification, and documentation of current medical knowledge through the completion of a minimum number of continuing education activities during that licensure period. They may also require continuing medical medical education on specific components that are areas of key concern for that state. For example, the State Board of Medicine in Pennsylvania requires clinicians to complete training focused on child abuse as well as pain management, focused on prescribing opioids and recognizing opioid abuse. Now, these medical boards also have the authority to take disciplinary action or corrective actions, which could include revocation of a medical license. How do doctors know what to prescribe, or kind of run in parallel, how do doctors know what to do in the treatment? We're focusing in primarily on the prescription area of this to keep this relatively short in this video. And so we can start out with the Food and Drug Administration, the organization that approves drugs as safe and effective in the United States, compiles a database that identifies drug products approved based on that safety and effectiveness. This database is referred to as the Orange Book. This database is updated monthly, so it has the most current information available. Before the widespread use of internet databases, physical copies of manuals such as the Physician's Desk Reference were updated annually with key information about approved medications, the indications, basically when the drug should be used, contraindications, basically when the drug shouldn't be used, and potential side effects. Today, electronic databases are maintained to provide this information directly to a prescriber's computer, tablet, or even their phone. Sometimes a doctor will prescribe a medication beyond what has been approved, which is described as off-label because it is used as a treatment that isn't described in the information provided with the medication or in the materials that are provided to the FDA for approval of that drug. While the FDA approves a medication for specific uses, it does not regulate the practice of medicine. This gives physicians the flexibility to use drugs that were shown to be safe and effective for one condition to be prescribed for another condition that does not have an approved or effective treatment. Alternatively, a physician may feel that a different medication is better suited to that patient's needs because of their unique situation. An example of this is when a medication that is approved to treat a specific form of cancer is used to treat a different form of cancer that the drug company tested and got the FDA approval for. This is common. A 2006 study found that 1 out of 5 prescriptions was for an off-label use. However, drug manufacturers and suppliers are forbidden from sharing information about off-label use of their medications. So with all of this training and experience and information, how is the practice of medicine being controlled? Professional speech is when a person speaks as an authority credentialed by advanced training, professional organization certification, and state licensure. As a professional, your behavior and actions are held to a standard of a professional code of conduct. In 2022, the American Medical Association, one of those larger organizations that basically sets the standards for physicians, adopted a policy to protect public health by stopping health professionals from spreading health-related disinformation. This was in response, in part, to a Center for Countering Digital Hate study that found that nearly 2/3 of anti-vaccine social media posts were traced to just 12 individuals. As part of their carrot and stick effort, they provide evidence-based information as a trusted source of reliable information for physicians and their patients, while ensuring that licensing and specialty boards have the authority to take action against individuals who use their credentials to violate the Code of Professional Conduct by spreading medical-related disinformation. However, this policy provides guidelines as recommendations rather than legal requirements. Some state medical boards have investigated or taken action against licensed physicians for spreading misinformation in the form of false or misleading statements or prescribing unproven treatments in their care of COVID patients, instead of providing the accepted standard of care. In 2022, California enacted a law that allowed the disciplining of a physician for sharing information that went against contemporary scientific consensus. This law was quickly challenged for violating physicians' free speech rights and interfering with the physician's ability to freely communicate with their patients. After a federal court issued an injunction against this law from taking effect, the law was repealed in late 2023. Also in 2023, Florida enacted laws empowering doctors to prescribe alternative treatments or to refuse treatment based on not their patients, personal, moral, ethical, and religious beliefs. It provides a path to protect their license from medical or accreditation boards from punishing them for their actions. The examples covered here focused on disinformation around the COVID-19 pandemic, which we are hopefully past. But how does this work in the post-Dodd era, where a woman's access to a safe abortion is no longer a federal right? So-called gag orders on physician speech and practice are becoming more common in areas such as reproductive rights and conversion therapy. So we are currently seeing arguments promoting the free speech rights of physicians promoting alternative views on COVID-19 treatments and vaccination, while at the same time limiting physicians' rights to speak about reproductive issues such as abortion. Is this consistent or possibly hypocritical? What will happen to society when the practice of medicine is politicized? As we consider the ethical dilemma in science for this week, please leave your comments below on whether what doctors say and prescribe should be regulated. Before we can consider the larger question, here are some prompts to get the thought process or discussion going. Is there a difference between free speech and professional speech in the medical world? Is the spread of medical disinformation a form of professional misconduct? And finally, is there a difference between a doctor's advice to a patient and the act of prescribing a medication or performing a treatment? In the description below is additional information and references. If you enjoyed this video, please like it and subscribe for more conversations on the ethical impact of science and technology on society. Until next time, stay curious and be informed.